Awesome. Good morning, good morning, good morning, everyone. Welcome in. This is Richelle, the Real Life Carnivore, welcoming you back. Today I have a super special guest. His name is Phil. He is a retired family physician, and I'm actually going to invite him. I'm not going to pump him up. I'm going to invite him to tell you guys his story and who he is and why he went carnivore. So join me in welcoming this morning, Phil. Phil, welcome to this channel. Welcome to the show. How are you?
Thanks, Richelle. I'm really glad to be here. We've actually met each other through Steak and Butter Gal community, and it's a great opportunity to chat with you today. So I hope we get to know each other even better today. I'm 67. I live in the Tampa Bay area of Florida. Been a carnivore for 16 months now. Started in August of 23 because I had metabolic syndrome. And I needed to reverse it because I had an infection of my heart back in 2001 called a viral cardiomyopathy. And that did some damage to my heart, ended up getting a pacemaker in 2019, about 2 weeks after I retired, which was kind of ironic. I guess I wasn't ready to retire, but the pacemaker came out in my first 2 weeks of retirement, which was kind of hilarious. And I have always enjoyed, as a board certified family physician and clinical informatician, when I was in medical school, I actually dual enrolled in graduate studies and got a master's in biological sciences in the area of interest in human physiology. So I've always been interested in human physiology, what works, and I practiced medicine in a small town in the Tampa Bay area up until the late 90s. My practice was called Health Lifestyles, PA, and I really used preventive medicine, fitness, and nutrition to help people get healthier, and always tried to stay up to date with the literature and what was done, and was in great health. Used to run 5K races. I used to run 2 miles a day, was extremely healthy. And in 2001, I got sidelined with a viral infection on my heart. Ended up gaining about 64 pounds. Had congestive heart failure, had paralysis of the front wall of my heart. I was short of breath walking across the room. And it was pretty challenging. And fortunately, with a couple medications, a beta blocker and an ACE inhibitor, I was able to survive that viral infection. About 20% of people with cardiomyopathy that, like I had, die of sudden death. About 25 to 30% end up needing a heart transplant. I was in the other group that my heart muscle healed, returned to a normal ejection fraction over the next couple years. Didn't have any coronary artery disease at all. So I was one of the fortunate ones. By this point, I had transitioned into medical informatics, clinical informatics. Was going around the hospital automating hospitals. I did over 70 in the transition from paper records to electronic medical records, became an expert in that field, published a couple books in the topic, and retired in 2019. And really struggled with my metabolism, my weight for a matter of years. Did multiple things, but in early 2023, saw that I was falling into metabolic syndrome and really had to get serious about what I needed to do. I was very familiar with keto diets, and I started put myself on a keto diet, having never heard of carnivore. And in August 3rd, after doing some study on the carnivore way of eating, I decided that would be a more strict ketogenic diet and decided to go jump in with both feet, and I haven't turned back. And found that the importance of being in a community because we're such oddballs. So joined the Steak and Butter Gang on October 30th of last year in 2023, and have been active in the community ever since. My 4th month as a carnivore, I totally reversed my metabolic syndrome and had a lot of additional health gains from that. But I have had some challenges over the last few years concerning my heart. Some is the damage from the metabolic profile or metabolic syndrome that I've already had. After the COVID vaccine, about 2 weeks after my second shot, I ended up having what we call paroxysmal or irregular atrial fibrillation. I've had 4 bouts of that, the longest lasting 2.5 hours in the last 2 years. Actually, in the last 3 years since 2021. And I'm very interested in staying as metabolically healthy as I can and dealing with that. But very much a advocate for ketogenic diets, specifically carnivore for myself. And I love to take very complicated ideas and make them simple so people can learn how to turn their personal doctor from being in a parent-child relationship into more of a partnership, because I've had to learn to do that myself and make my doctor my partner rather than someone who just tells me, oh, that's good to do and that's bad to do, and becomes my school marm. So that's something I always like to talk to people with. So
Can you explain to people who may not understand or know what metabolic syndrome is? What is metabolic syndrome? I'm familiar with it, but I think there are a lot of people who hear about it, but they actually don't know what
yeah,
that means.
well, thanks. I'm glad you brought that up because I'm making an assumption. So years ago, when I was still in practice in the 90s, it started to be recognized that it was a pre-diabetic state, and was originally called Syndrome X because they didn't know what to call it. And there are 5 hallmarks of metabolic syndrome or Syndrome X, formerly known as Syndrome X. So it's obesity, which is defined as a BMI greater than 30. So a BMI greater from 25 to 30 is considered overweight, and a BMI greater than 30 is considered obesity. So we have to know what our terms are for our definitions. And I'm not trying to say BMIs are the way to go, but that's the clinical diagnosis. So I'm just going to stick with what the medical criteria are. There are 5 criteria for metabolic syndrome. You have to have 3 of the 5, but 80% of Americans have 2 or more of these, which is really pretty sad. So obesity is number 1. Second is systemic hypertension, which is elevated blood pressure out at your arm. Number 3 is elevated triglycerides. In the United States, that's elevated at 150 milligram per deciliter is the number. And I'm sorry if you're in the UK or Australia, they measure triglycerides differently in millimoles per liter. So we have different numbers, and I don't know those off the top of my head. I could look those up, but 150 milligrams per deciliter in the United States. A low HDL cholesterol level. Typically, we're looking for, I kind of use a guideline of less than 35 in men and less than 45. So if you use the rule of thumb, less than 40 milligrams per deciliter kind of a good rule of thumb if we want to stay on average. So, and an elevated fasting blood sugar. So normally higher than 90 milligrams per deciliter in the US. And again, if you're in other countries, that may be something much lower than that in millimoles per liter. So if you have 5 out of 5 of those, or 3 out of 5 of those, or 4 out of 5 of those, you're considered to be in metabolic syndrome. And if you have 1 or 2 of those, you're considered to be metabolically not optimal. And if you have 0 of those, that's a good sign. So these are considered a cardiovascular risk factor for coronary artery disease and stroke. And in fact, it increases a person risk of atherosclerotic disease by 600% or 6 times
Whoa.
over the next 10 years. So it's an extremely high risk factor. It's actually the second highest risk factor we have, second to diabetes. And the following ones are the third risk factors, which are cigarette smoking, hypertension, high blood pressure alone, obesity alone, or cigarette smoking alone are considered the third tier of risk factors. So metabolic syndrome is extremely high. People can be normal weight and have metabolic syndrome because and we look at obesity characterized by either the BMI or by a abdominal girth of greater than 40 inches in US measures in Americans. We'd have to convert that to centimeters in men and 38 inches in females. So you can use that or the BMI for criteria for the obesity. But it seems to be the waist is considered a better proxy than the BMI because you can have a high BMI and be very muscular. But if you have that central obesity or what we call kind of the apple-shaped body, where your weight is in your abdomen, that's considered a risk factor for metabolic syndrome. So you want to be a purist, the 5 criteria. So let's make sure I got them. Low HDL, high triglyceride, elevated blood sugar, elevated blood pressure, and elevated wrist circumference or waist circumference.
Yeah.
But I would use the BMI as a proxy for that, unless you're this super muscular type of guy who isn't obese, but you're just a massive person, like a football player.
Or muscular gal.
Yeah, very muscular gal. Yeah.
I fall into that category.
Like a bodybuilder. You were a bodybuilder.
I fall into that category for sure.
Yeah, yeah.
Okay, what percentage of Americans are actually affected by metabolic syndrome? Do you know?
So we think it's around 40 to 50%, and it's kind of a silent killer. When I was in practice, we were just defining it in the late 80s and early 90s.
Mm-hmm.
Like I said, we called it Syndrome X, but
Mm-hmm.
it's really caught up to me, and nobody really called me. My doctors didn't call me metabolic syndrome until 23, but I actually had the markers back in 20. It's just I'd have one, then the other, and
Mm-hmm.
you look at one number, you look at 2 numbers, you don't meet all 3 on any one day, but then you meet one this time and one the next time, and you actually are developing it long before you have all 3 of them definitely over the top. So I wouldn't have persistent high blood pressure, but I would have intermittent elevations of blood pressure, intermittent fasting sugars in the like 100, which we used to consider that years ago, we used to consider that normal. We used to say fasting greater than 120 was of concern. But now we've lowered that criteria. We've lowered the criteria for normal blood pressure. Used to be under 140 over 90. Now it's kind of 120 over 80, with 130 over 80 kind of being borderline at this point. So you have to also fit that in, that blood pressure alone may be over exaggerated because they've lowered the criteria. But part of the reason they've lowered the criteria is more and more people are metabolically unhealthy. And so we're trying to raise awareness of it and make you think about these things. And,
Well,
but, you know, poor metabolic health is a major risk factor for atherosclerotic heart disease. So, and hardening of the arteries, as we used to call it years ago, or plaque in your arteries, is associated with cardiovascular events, which are heart attacks, strokes, congestive heart failure, uncontrolled hypertension, kidney failure. They're all related to downstream effects of atherosclerotic disease and metabolic disease.
if I understand correctly, the reason why people get calcifications or hardening of their arteries is because there's like a weak point in the artery. And so that's like the inappropriate application of calcium in the arteries. Is that true? Is that what
Well,
happens?
it plays a role. There are many, many theories of atherogenesis. Atherogenesis is the um, origin of plaque. Okay, literally, that's what it means. Genesis meaning the origins of, and athero being plaque. And there's different types of plaque, from fat laden plaques to what we call soft plaques and hard plaques. And the hard plaques are the ones that have more calcium in them. And we now know that calcified plaques happen in a variety of conditions, one of which is people that are low in vitamin K2 and taking large amounts of calcium supplementation. There's a tendency that in our zeal in trying to get people's calcium replaced to treat osteoporosis and osteopenia, we're giving extremely high doses of calcium supplementation in people that are dietarily low in K2 or deficient, or deficient in vitamin D3. And then that calcium cannot be properly utilized into mineralization of our skeleton. And that excess calcium can deposit in our arteries and we get calcified arteries. So, but that's just one mechanisms of things that go awry when we're metabolically not healthy. And low protein or protein deficient diets also make us not able to add as much calcium to our skeleton. And so that plays a role in osteoporosis as well. So hormonal balances and vitamin balances and mineral balances in our body are very complex, and they're not as simple as people assume they are. And so if you're metabolically not healthy, you're going to have more um, opportunities to do things in a less optimal way than if you do get into prime metabolic health.
And I think that's kind of what we're after is the prime metabolic health. And I actually want to ask you before we go into sharing more about our stories, why do you suspect or what do you think is the main reason why 40+% of Americans are struggling with or currently have metabolic syndrome?
Well, I think it's multifactorial. Um, I don't want to claim one or the other, but we do know that we're seeing more inflammatory diseases now. We're seeing a difference in countries where uh, there is more genetically modified foods, there's more grains being consumed, more seed oils being consumed. And there's a lot of research coming forth. I noticed for myself, I have a problem digesting um, wheat in the United States, but I went to Italy where we do not have genetically modified wheat in that country. And I could eat foods with no side effects. But if I ate those same foods in the United States, I would have inflammatory and GI side effects immediately eating the same foods. So that is a pretty good indicator for me. And that's anecdotal, that's not scientific, but there's more and more literature being published to question the inflammatory effects of the American diet and how it's impacting us. Um, and I think it's going to be interesting as we look at this more scientifically over the next 4 years. I think we're going to discover a lot. And I think we need to be open minded and not be dogmatic on what we do, but also pay attention to how our individual bodies respond to the things that we eat. And where the science is very interesting, and most dietary science has been epidemiologically based and not based on peer reviewed double blinded studies. So we are left with having to consider what we call N equal one
Mm-hmm.
experiments on our own, which is where we do elimination diets and do something for 30 days and eliminate something and then reintroduce it for 30 days and keep diaries and see what happens and become our own test subjects. I think we do not, I think we overestimate the generalization of diet in the United States to entire populations. And my experience, both as a practicing physician, as a father, as a husband, as someone in communities of people that pay attention to nutrition, I would say we tend to forget about the extreme biological variability we have due to our backgrounds in what we've been exposed to all of our life, our genetic makeups, our heritages, um, based on our races, our countries of origin, and all that, and our conditioning of our intestinal, tract to what we've been exposed to all of our life, and to the foods that we're consuming, um, and how things have changed through the last few years with the addition of pesticides and glycosates and fertilizers and things that are and genetic engineering of our food. And it's very hard to control things based on what we're exposed to. I mean, I grew up very organic. We always had our family farm and grew our own vegetables and canned things and ate that. In the first 13 years of my life, it was pretty rare that I ever had anything from a store. I'm going to have a different experience and gut biome than someone who grew up in the city and or grew up with canned, um, industrially canned meats and foods, or from different cultures and different ways of preparing food. So I I think it's really hard to get good science in this. We can begin to make some generalization from population data, but it still comes down to our individual curiosity of what works for us as individuals. And all I can say is, as someone who has been watching the literature year by year, decade by decade, and seeing the explosion of epidemic of obesity and metabolic disease, what we're doing is not working, and it has made us less healthy as a society in Western, at least the United States and Western culture. So what we're doing isn't working. So we need to be curious, and we need to do things that are a little more out there. And in that space, ketogenic diets have been studied probably the most scientifically and been under the microscope the most. And we have almost 100 years of good literature because of their uses in with epilepsy and diabetes before we had insulin, and all the work that's being done in places like Brigham Young and Duke University and Boston University and the people that are really doing deep dives and scientifically looking at this, and our own personal experience of inflammatory conditions that resolve almost immediately when you go and change your diet from a standard American diet into a more ketogenic diet.
Mm-hmm.
Mine was folliculitis. I had chronic scalp folliculitis for years and had to take doxycycline, which is a tetracycline type of drug, for 30 days, 4 times a year to keep it under control. I would get pustules on my scalp. And I just saw my dermatologist this morning for my annual skin checkup. And I live in Florida. I've had no new skin keratoses, which are precancers. Um, and so I didn't have anything that's needed frozen. I've had no folliculitis since 2 weeks into the carnivore way of eating. Um, I used to get adult acne, which is a form of rosacea, and I've had 3 pimples in the last 15 months. All occurred the same week.
Oh,
So
geez.
something I ate that week didn't do good, but the fact was, you begin to notice that if your skin's less inflamed, and also I just went through cleaning up our wooded property for after 2 hurricanes here in Florida. And I did almost 20 days of yard pickup and stooping and bending and chainsawing and bagging over 100 bags of yard waste between the 2 hurricanes. And my recovery time is immediately. I used to do 3 hours of work and then I have to rest for 3 days and do 3 hours. And now I did 10 days continuous with a Sabbath rest over each of those 2-week times after the hurricanes, and don't have the muscle pains and aches. And I mean, it's amazing the difference a year makes of eating a non-inflammatory diet.
Yeah, there are so many things that you just touched on that just speak to me, particularly around the sensitivity to wheat and gluten. In the early 2000s, I think, is when they started going to the genetically modified wheat. I don't know the exact numbers, but I'm just going to use these as ballpark figures. So I think original wheat has like 12 strands of DNA, and they've modified it so it has about 64 now. So it's like certain pests, it's resistant to certain pests, certain molds, certain fungi, certain bacteria and stuff like that, because it's supposed to make it more hardy. They've also modified it so it grows faster, so they can have more than one cut in a year. And I noticed it was when I started getting into competitive bodybuilding that's when I started having a sensitivity to wheat. And it was in 2011. So it was about 11-ish years after they started introducing the GMO products. I started cluing in, like, something's not right. Like, I wouldn't eat any wheat during my training period during the week, but I was allowed one meal a week where I could have a cheat, and I could eat whatever I wanted for that meal and just enjoy it. And my favorite thing is always hamburgers. I would always go for a burger. And I would get a burger, and the whole thing was like, oh, whole wheat is better than white bread. So I would get it on a whole wheat bun, and then I would be in excruciating pain for hours. And I'm like, what is wrong? And so I just decided I'm going to try a burger next week with no bun and just see how it goes. And I ate the burger without the bun the next week, no pain. And I was like, oh, this is like revelatory for me. I said, okay, so it must be something in the wheat. And then everything started coming out about that. And there was like a huge surge in diagnosis of celiac disease.
Yeah.
But people often don't correlate that. And I think it's very interesting because not only is our wheat modified, but corn is modified. Milk has been modified. And I say it's been modified because it's been homogenized and it's been pasteurized. So basically anything that was good in it is now cooked down and out of the protein molecules. Everything is all changed. And so I wasn't able to eat dairy. I wasn't able to eat wheat, and I mean, like you, I grew up, my mom, we had a massive garden. We would probably harvest, I would say, close to 300 pounds of potatoes a year. And like we had a raspberry patch, we had carrots, we had onions, we had the potatoes, sometimes we would do corn, we would do peppers, we would do tomatoes, and like your family, we would can it. We would can the tomatoes, we would can peaches, we would can, all the fruits and everything like that. And those things I was able to digest. I had no issues with those, but it's like you get into this mindset of like, oh, well, it's not healthy to, eat things that are canned or have been processed or something like that. But I felt like I was healthier then than I was when I started competing. And I think it's like you were kind of saying, the modification of food, and just my body, just the stress from work and what I was going through, what I was being exposed to, environmental toxins, cleaning products, those types of things. All of those things had a major impact on my microbiome, on my fertility, on everything. And I think that the more awareness we can bring about this, I think the better. And I'm not saying people have to be dogmatic, like you were mentioning earlier. It doesn't have to just be lion diet and that's it. I think that people are able to do this for a short period of time, see significant improvement, and then slowly reintroduce and see if they have any sort of adverse reactions. And one more thing, because I know you have questions, you were mentioning the difference between eating wheat products in Europe versus in the US. I've heard this from numerous accounts. And I believe that to be true as well, because it's not been genetically modified, because they have, stronger stipulations over there. But I also just recently learned, and you might find this interesting, sourdough bread. Okay. This blew my mind. I have not had cravings for anything for almost 2 years. And I had been craving sourdough. And I'm like, what a weird thing to crave. What a weird thing to crave. So I talked to my husband about it and I was like, I don't know why I'm craving this, but like, I'm going to do some research about it and just see what I can find. And it's like, I also prayed about it. And then the next day I come across this video of a man who, it was titled something like, Dad checks his blood sugar after eating sourdough bread. And his blood sugar went from 115 down to 85 after eating the sourdough bread. And so I was like, what is going on? And it's due to the fermentation of the grains. It does not drop your ketones, and for some people, if they are not metabolically sick, it can lower their blood sugar. And I was like, what? So this is going to be a point of research for me, but I just wanted to share that with you because I just found it super fascinating. It's almost like God's design, back in Bible times, they wouldn't have had a little jar of yeast. You would have had to ferment your own grains. You would have had to mill it and then prepare it and then ferment it. And it would have had to go through that process. And now it's like, I can just buy this little jar of yeast and have bread right now. So anyway, that's a whole other subject, but I just think it's super interesting. And I just had to, to share that with you.
Well, as a physiologist, I do have to correct that it's original wheat, ancient wheat was 14 chromosomes.
14. Okay, thank you.
European wheat is 28 chromosome, and dwarf wheat in the United States is 42 chromosome.
42. Okay, and, so maybe it was in Canada, it was 64.
Yeah, well, it's very possible that there's a 64 because the which would be 42 plus 14 would be 50. Wouldn't it be 56 or? Yeah, so 56 would be the next one. But the interesting thing is, when a sperm and an egg get together, the chromosomes stay the same number.
Mm-hmm.
And when they genetically modify the wheat, they're actually doubling and tripling the chromosomes.
Mm-hmm.
And it's thought that that third group of chromosomes that's added on is inflammatory to about 10%, maybe more of the population. So, what we call gluten sensitivity is actually what we should call
GMO sensitivity.
Well, yeah, it's literally called the delta chain, the delta chromosomes. Delta chromosome sensitivity. But it's interesting, the sourdough bread thing, because that makes perfect sense, especially if you can make it with Italian wheat, which is the modern wheat, which we've used for 120 years, versus the like you said, a couple of decades of the GMO, the dwarf wheat. But the dwarf wheat, what's the benefit of the dwarf wheat? Well, 2 growing seasons. Because it's dwarf, it grows to maturity faster. They do a winter a fall winter season. They do a spring season, so that they get 2 crops from it, and they get more yield per acre. So it's not just doubling; it's more than doubling, and so that's how you feed the world. But
Mm-hmm.
unfortunately, some of us are innocent bystanders who our body can't do it, and so you have to. It's like a trade-off.
Mm-hmm.
Do we let people starve or do we give them something? And it would be great if everybody could get the purest stuff possible, but there are unintended consequences if you can't grow enough food to feed the people. So I
Mm-hmm.
I try not to villainize where things are going, except when it's manipulation to make us think that that's the only choice we have in life. And
Mm-hmm.
fortunately, we live in a capitalist society, so we do get to make a choice
Mm-hmm.
of what we put in our body. But there are cultures where, you know, there there is starvation going on, and you do have to make those life and death
Mm-hmm.
decisions sometimes. This is what we call third world versus first world problems. So anyway, how'd you get started on the carnivore way of eating? What was your motivation?
My motivation 100% was fertility. My husband and I, when we lived in Canada, we had tried for about 2 years to get pregnant and we were unsuccessful. I found a physician that would take us during the whole COVID epidemic because I did have a family physician. But when I asked him about it, I said, "Look, I've been trying to get pregnant for almost 2 years, and
Mhm.
we haven't been successful. Like, is there like a fertility clinic we can get a referral to, like to get some testing done? Like, something just doesn't seem right." And both my husband and I both have a history with bodybuilding and competing and stuff like that. So for him getting his body fat sub 6%, for me getting my body fat sub 10%, there are consequences for that. And so
Yeah.
for me, it was shutting down my complete endocrine system. I still had a cycle, but I didn't ovulate. I was anovulatory for close to a decade.
Wow.
So my GP, he did a test in house and he was like, "Oh, you're fine. Your numbers are fine." And I was like, "No, I don't think so." And so, in sharing my story and my concerns with a friend, she said, "I'll ask my doctor if he's willing to take on new patients," because she had a really good relationship with him. And so she asked him, and he couldn't believe, that we had been trying for 2 years and how this other doctor had just dismissed us. So he took me on as a patient. He started doing some testing, and he was like, "Oh, you have elevated prolactin." And I said, "Okay." And prolactin, obviously, you would know, but for those who don't know what prolactin is, that's the lactation hormone. He said, typically that coincides with having a benign pituitary tumor because as this benign pituitary tumor grows, it like suppresses certain functions in the endocrine system, but elevates prolactin. And so we monitored my prolactin for about 6 weeks and it continuously rose. And so he said, "I think I need to send you for an MRI." And I said, "Okay." So I went for this MRI, and sure enough, there was a 1.2 centimeter pituitary
Millimeter.
tumor.
Yep.
And he was
Centimeter or millimeter?
centimeter.
Really?
Yes, 1.2 centimeter.
That's really big.
Yeah, because considering the pituitary is just teeny tiny, right? How big is the pituitary?
It's not much bigger than that. So that was probably engulfing your pituitary gland.
Hmm.
That's that's a biggest one I've ever heard.
Yeah, and I have all the medical records and my conversations with him. He was so wonderful. He was so kind. And so because of that, he was able to say, "Okay, and he checked me on the 21st day of my cycle and he checked on the first 10 days of my cycle." Like, I mean, I had more more lab work done in a 6-week period than I think I've had done in my entire life. And anyway, he was able to get us a referral to the fertility clinic because he said it would also be great just to get my husband checked, just to rule him out. So he was diagnosed completely infertile. I was diagnosed completely infertile, and we ended up moving to the US because my husband got a job down here. And I think it was about 2 weeks after we arrived, we finally had our appointment with the fertility doctor, and he gave us our final clinical diagnosis. And I remember sitting there, I was parked on the side of the highway between Louisiana and Texas on a 3-way phone call with this doctor. And he was so doom and gloom. And he was like, yeah, so basically you guys are both infertile. The only way that you guys would ever be able to conceive is through fertility treatment. Like, we can look at doing in vitro, we can look at a surrogate, we can do an egg. And he started going through this stuff. And I was like, what are you talking about? Like, we must have missed something. It's not that we ate poorly. I mean, I had a restrictive binge eating disorder for a very, very long time. So, I mean, I ate a lot of inflammatory foods in secret. But my husband, like, I mean, I would always prepare like the best of the best for him. Like, you know, it was very good quality meats and, you know, good organic everything. And, you know, I tried to be very by the book in that regard, and what I brought into our home for his sake, because I wanted him to be healthy. I don't know why I didn't want the same things for myself, but I think I was just in denial about it. And so my first thought was, you know, this guy clearly doesn't know God, and he doesn't know my God, because there's got to be something we missed. And then my second thought was, well, we need to figure out what we missed. And ironically, we prayed about it. And a few weeks later, my husband got a phone call from a friend, and he was sharing with him, oh, you know, I had all this like chronic back pain I couldn't get rid of, and I went carnivore for 90 days, and now I'm able to eat other things again, and I don't have any more back pain. My back pain's never come back. My husband had this like chronic aching in his elbow for almost 2 years. He had had a snowboarding incident where he landed on his elbow. We thought, I'm pretty sure he tore his tricep, or partially tore his tricep, but he just couldn't get rid of this elbow pain. And so he talked to me about it. He sent me Dr. Ken Berry's video on, you know, trying carnivore, what are the basics. And then that led me to Kelly Hogan's testimony, where she overcame infertility and had 3 successful pregnancies, was able to breastfeed with all pregnancies. I was like, oh my gosh, I'm in. As soon as I heard her testimony, I called my husband. I said, we're doing this. Like, I want to do this. I don't care. I want to do this. And it was, oh man, it was a struggle. It was a real struggle. My husband wanted to go lion straight off the hop, which for someone who has a sugar addiction, a carb addiction, and a restrictive binge eating disorder that's in the closet about it, that's not an easy thing to do, to go from one extreme to the other. And I'm usually pretty good at being on a pendulum to swing like that, but I just could not. I could not. And it was the week before my period when we started, so I was miserable. My husband can attest to that. I was not a very nice person. And so I said to him, I was like, there's got to be more variety than this. I must be able to do more than just like beef, salt, water. I'm starving. 2 steaks a day is not enough food for me. Like, maybe it is for you, but not for me. Like, I'm starving. And so I started coming across more content. I came across Bella, the steak and butter gal, and saw how much she was eating. And I was like, oh, wow, like these people really, like, they know how to eat. And then I talked my husband into letting me join the steak and butter gang. And then I came across Raymond's protocol, and I got permission to eat, and I got permission to eat dairy. I got permission to eat, even if I had to eat processed meats, like cured meats and stuff like that, just to give me some variety and whatever. That was how I got into it. And it was October 2nd, 2022, when we went lion. And then I started priming starting November. And we actually conceived in the end of December. I miscarried in January because I had a history of miscarriage previous. I miscarried in January, and then we got pregnant with my beautiful baby boy in April, and I delivered him last December. So he'll be a year in December, which is very exciting to me. But that is the long of the short of what happened with us and how I went carnivore. And I've remained, I would say, probably 95% carnivore, because seasonings and spices. And when I was pregnant, I craved watermelon, which I hate. I hate watermelon. It's disgusting. But I craved watermelon for the first week. And that's how I knew. I was like, okay, I must be pregnant because I'm craving watermelon and I do not like it.
So did you ever have any follow-up of the adenoma, pituitary adenoma?
No. So because we're not in Canada and MRIs and healthcare is insanely overpriced and there is no price transparency in the US about it. I have not gone back to have it checked, but I would say it must have improved or shrunk at least. And I say that because I don't have the headaches anymore. I don't have, well, I mean, I'm still breastfeeding, so I can't say anything about the prolactin, but there are just some things that just don't seem to happen anymore. You know, like I used to get like eye twitches. I used to get like my vision would just go blurry. I would get really dizzy and stuff like that. And so I think that that had a lot to do with the pituitary tumor. I don't know. I can only kind of speculate. It was never confirmed, but those are kind of my suspicions about it.
Yeah. Well, so when you have a pituitary adenoma that big, you actually get a ballooning of what's called the pituitary fossa, which is a bony case behind your nose that surrounds the pituitary gland. And as you get an adenoma, it gets bigger. Now, remember, the whole thing is about the size of pituitary is about the size of I'm trying to think of a vegetable that might fit that. Bigger than a pea, but smaller than a grape. I'll put it in that category.
Okay.
And the regular skull X-rays will actually show what we call ballooning, which means enlargement of that pituitary fossa. But then if the pituitary shrinks because you're hormonally not driving that prolactin secretion anymore, you know, the adenoma, I would suspect would shrink and kind of what we call involute or kind of collapse on itself. It would be interesting to know that. Unfortunately, a skull X-ray won't help because the ballooning would have already happened, and that's not going to reverse. So you're always going to have more space around your pituitary gland. But I'm just really curious. If you're in ever a situation you can get an MRI of the head, it would be very interesting to know if you were able to totally reverse that, because it sounds like hormonally you shut it down, but I'm wondering if the tumor itself completely dissolved.
Yeah, and that's kind of my curiosity too. And part of me is like, should I just go back to Canada and get an MRI? You know, obviously in the carnivore space, in the keto space, and that sort of thing, we hear that there's a benefit to being low carb or zero carb, that it can help shrink tumors, that, you know, any sort of strange anomalies in the body can improve. I'm sure you'll correct me on this, but I've done some research about this, and I've read that the brain can function on ketones or glucose, but it actually functions more optimally and prefers ketones over glucose. Is that true?
Correct. That's true. That's true. So the interesting thing about this is I assume you're nursing still.
Yes.
So that's all your nursing, your milk letdown is all driven by prolactin. And it's kind of interesting because you went from a prolactin developing tumor to now probably a pretty normal prolactin production. It's a tongue twister, so I better not challenge saying it too many times. But I'm very interested in the natural course of this, because it would be so cool if we had demonstrated radiological evidence that you actually, the tumor involuted on its own just because you're hormonally in a better place than you are. But isn't it ironic that you and your husband were bodybuilders and yet you were so metabolically desolate or bankrupt?
Yeah.
With the
Well,
wrong
and
hormone?
that's the price. That's the price you pay for certain things. Like, yeah, did we look great? 100%. We looked fantastic. We looked amazing. Did I feel great? No. And I'm very transparent about this. I was very moody. My cycles were gnarly and all over the place. Like, I also wasn't ovulating. Like just mood disorders, insomnia, ADHD, OCD, ADD, PTSD from childhood trauma was compounded in there. There were just so many things that ailed me. My husband, not so much, like, chronic pain and stuff like that. I also had chronic pain. I had a really bad accident when I was in 5th grade. I was qualifying for high jump in track and field. And I qualified so well that I overshot the bar and the mat, and I landed on my shoulder. I separated my shoulder and I popped out my collarbones. They're actually not even aligned. These are my collarbones.
Okay.
And like just completely compressed the discs from C7 all the way up to C1. Like there's basically no disc left. It's just all bone spurs and calcifications that hardly moves. And it took many years of chiropractic care and several x-rays for me to start to see like, oh my gosh, like there's something going on here. I first got diagnosed with osteoarthritis when I was 23. And the chiropractor was amazing. He saw me 6 days a week because I was just in so much pain all of the time. And he was like, at some point, like, we need to get you so you're not in so much pain. And then I started seeing a naturopath. I tried ozone injections. I tried prolotherapy, which is like those dextrose injections. They're supposed to be helpful for rehydrating tissues and whatever. I saw small, minute improvements with that. It's also supposed to cause an inflammatory reaction in the tendons and the tissues to help, stimulate healing in the area. So I've used it on my SI joints because I fell 16 feet, fractured my pelvis, dislocated my right SI joint. I mean, I've had a lot of accidents. There were a lot of near misses, and times where I could have gone to meet our maker, but didn't. I would say the most significant time was when I got T-boned by a semi truck on the highway. I spun out on black ice and I was like, okay, this is it. This is where I die. And here I am sitting here having a conversation with you, but my body's been through the ringer. And it was after I cut out sweeteners, about 6 weeks in after I cut out sweeteners, that I saw such a dramatic reduction in my pain that my husband even noticed within 2 days. He was like, you haven't complained about neck pain. And I was like, I haven't, because I am not feeling it. Like it went from like a 9, 10 every single day down to a 2. And I was like, I can handle a 2. Have you ever lived with chronic pain like that?
No, I haven't. And I want to tell you that we share a common thing now that I didn't know. I also got hit by a semi-trailer tractor sitting at a traffic light, and it was during one of those notorious downpours in Florida, and he couldn't get stopped. And there's nothing like getting hit when you're a stationary object and you get hit by an 18-wheeler. And to be able to walk away from that is pretty amazing. But I am currently recovering from a very, very painful condition. I had a cardiac catheterization 2 weeks ago today through my left radial artery in my wrist. And unfortunately, I developed a blood clot at the injection site, which turned into arterial spasms 4 days post-procedure and ended up clotting off 8 inches of my radial artery in my forearm. And I've had like extreme severe pain for the last 2 weeks, but it's been totally controlled by just taking 500 milligrams of Tylenol every 3 hours, which is pretty incredible because I think most people would be writhing in pain with it, but I just have really good mind-body control of pain right now. And some of that's diet, some of that is what I've developed through the years because I was trained in medical school to do hypnosis. And I'm kind of weird. I have so many weird things, but I do self-hypnosis for dental work. So I've had 3 root canals under self-hypnosis with no lidocaine, no numbing medicine. And
what? That is not something we have in common because me and the dentist, I didn't realize every time I would go to the dentist, I would get really extreme anxiety. and I would usually end up with like a cold sore breakout from it. And I couldn't figure out why. And then I remembered when I think I was 15, I had to have my wisdom teeth removed. And my body metabolizes lidocaine and sedation at like 4 times the normal rate that it would be for a regular person. I don't know why. It's just the way my body is. And
Yeah.
they sedated me, and then they freeze your gums and whatever, and they're like, oh, can you feel anything, whatever, and then they sedate you, and they broke this tooth, and I came out of the sedation and my mouth wasn't frozen. And I had one nurse on either of my legs, one on either of my hands, and then another one holding my head down as they pulled all 4 of my teeth out. Like, they hit me 6 or 7 times with the sedation, and my body just nope, 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 nope. And it wasn't until I was 30 something that I was like, oh my gosh, that's why I freak out every time I go to the dentist. Because I ended up with my first cavity when I was like 31 or something like that. I was like, how do I have cavities? Aren't my teeth solid? And then, nobody had ever talked to me about a water pick. I flossed my teeth, but because I had orthodontic treatment 3 times, the gap between my 2 back molars just is the perfect little spot for food to sit. And if I don't floss it out and water pick it out, cavities come on. So I haven't had one, thank the Lord, but yeah. Really
So I've never seen a rapid metabolizer of the canes before, but I've certainly read about them.
Mm-hmm.
So you're the first one I've actually run into. That's a bad thing to have. Yeah.
No, it was not a good thing. Anytime I've ever had to have like a surgery, like in 2013, I broke my ankle. I said, I hope you guys are actually putting me out for this, because if you just sedate me, there's going to be a problem. You guys are going to be cutting into my leg and moving bones and screwing stuff in, and I'm going to be awake for the whole thing. I do not want to be awake for that.
Yeah.
Yeah.
So anyway, the interesting thing, what has been the biggest lesson you've learned in your carnivore journey,
The biggest
other than having a baby, which is
oh my gosh,
huge? What else has changed in your life that's been pretty dramatic?
I would say, I mean, there are so many things. I would say food freedom is a huge one. I never thought I would overcome the restrictive binge eating disorder. I thought I was just going to have that for the rest of my life, and I was just going to have to keep it in the closet. Like, even my sweet husband he had no idea how bad I struggled with it. He knows now because we talk about it. Yeah, I think experiencing food freedom, like being able to fast, and fast from a nourished state, because that's a very different place to fast from than to fast because I'm restricting. I would say, that I don't have to live in pain, not living in chronic crippling pain. It's not normal to wake up with your eyes, half swollen shut because you're puffy from something you ate yesterday. It's not normal to be chronically congested or have postnasal drip. It's not normal to have such severe allergies that even opening a door or a window in your house for 10 seconds, to let the dogs out can cause you to have such a reaction that you need to take 4 Benadryl and lay down, kind of thing. I think it's just the awareness that how I was living my life was, I was just highly, highly inflamed. Infertility is not normal. Digestive distress is not normal. Insomnia is not normal. And so I think all of these things have kind of led me to realize, while I may think I'm eating well, I always have room to grow and room to learn. Do I think I'll be carnivore forever? I don't know. If this sourdough conundrum comes about and proves to be true, I'm probably going to experiment with that, because I don't know. I'm still craving it. It's been like 3.5, 4 weeks now that I've been craving this stupid sourdough. I'm like, I don't know what the problem is. And I can make it. I know how to make it. I love making sourdough bread, and I make bread for other people. Just because I know people enjoy it, and then I know that there's going to be something good quality that I can give to people. But yeah, I would say all of these things Like, you don't have to live your life in suffering. That would be the biggest lesson. You do not have to live your life in suffering. There will be suffering in this life, that is guaranteed. But I don't have to suffer in silence and suffer in chronic pain and be depressed and, just all of these other things. What about you? What would you say are the biggest things you've learned?
Well, I think the biggest benefit is I feel like um, this way of eating is the most anti-inflammatory situation that you can possibly have. And as I was talking about doing, it was pretty obvious with the folliculitis that cleared up and the fact that I could work basically almost continuously for a month, cleaning up after 2 hurricanes and not be sore. And to to just know that I have this kind of confidence and calm about me, um, it's really good. It's a good place to be because I spent most of my life overworking of my own choice. Very intense person, very short with people, and I've become much calmer and reflective and curious. I think the curiosity is something that I think that most of us get a little too dogmatic and start fitting into the rules of life and don't ask themselves, I wonder what would happen if I made this one change in my life. I wonder why I'm experiencing this. And I think having wonder and curiosity is a real benefit of being in the community because I'm around people that are doing something a little different and we're seeing the health benefit of it. And also being in a community of like-minded people that I would have never met had I not been in this community. So, and that's a supportive thing as well as a helpful reminder. But ultimately, it's knowing why I'm doing it, why I'm bucking the trend, and continually reminding me of what's the alternative, what would I be going back to? And I recently learned that I have, from my metabolic syndrome, I have some small vessel damage to my heart. I have some small vessel damage to my brainstem, and that results in some central sleep apnea that I didn't even know I had. And I want to heal that over time and not go back to where I'm eating inflammatory foods and things that are going to make me metabolically unhealthy because I want to be around for my grandkids and my great grandkids and my wife and my own kids and
Mm.
just I'm not done contributing.
Mhm. Mhm. I really love that you shared that and you just put that into my awareness. I'm not as reactive now. Like you're just saying that and I much like you, I'm a go-getter. I'm very motivated. I definitely would say that I was one who overworked by choice. It was my choice to work as hard as I worked. Um, and I was short with people. I was very brash, and now it's a different story. I'm able to just kind of pause and just listen and think about things and think before I speak. The carnivore calm is a real thing and it applies to many aspects of my life. But I like what you're saying about being around for your children and your grandchildren and your great grandchildren and your wife and your family. Because, yeah, I mean, it's so easy to get caught up in the diagnosis of certain things, and I'm sure you've heard me say this, but if you haven't, please forgive me. But I am of the belief that a diagnosis does not equal a death sentence. And I mean, previously it would have for me. It would have meant, having this diagnosis of infertility would have meant, there's no hope for you. Like, you're never going to get pregnant. You're going to have to spend the $40,000 that you don't have to have a baby. And for it to be healthy. And, I'm just so grateful, for the doors that have opened and for the people that I've met, and, you in particular as well, hearing your stories of overcoming, even with your heart issues and stuff like that, you still have a heart to serve. Your heart is still beating because there's a reason for it to be beating. And I really love what you contribute to the Steak and Butter Gang. I really love what you contribute, to us as individuals. I love your, you were talking about it at the beginning of the call and stuff like that. Your problem solving skills are second to none. I really enjoy listening to you problem solve and make complex things very simple. You have a very big gift of that, being able to break complicated ideas down into very simple, understandable, digestible terms, which is really helpful because a lot of us struggle with big concepts and things like that, but you're able to make it into little bite-sized pieces. And I think that's really helpful and constructive for a lot of people.
Well, it's a gift that God gave me. And you heard about, did you ever hear about what I did from 93 to 2013 with my reading plan?
I don't think so. Tell me about it.
So one of my mentors in life said that if you read a book, 3 books on a topic, you will know more than 95% of the population on that topic. And if you read 5 books on that topic, you'll know more than 99% of people. And in 1993, I took that information and decided to commit to read 1 nonfiction book a week. And I read pretty much 30 minutes before I went to bed every night, nonfiction only, and did that for 20 years. During that time, I read 2,000 books on over 250 topics. And so I would read 3 to 5 books on a topic and then move on to another topic. And it was topics, all kinds of topics, not just medical, not just self-improvement. I mean, I would read on very esoteric things like municipal bonds. I mean, it's really hard to read 5 books on municipal bonds, but I did. And I had this very, very extensive library, and I would do either 5 books on a topic or 5 books by an author who was an expert on one topic. And, things like change management, things like conflict resolution, negotiation, all areas of psychology and medicine and social sciences. And the bad news is it kind of makes me come across arrogant sometimes because people think you're a know-it-all. But the good news is I have this uncanny ability to see what are called unintended consequences of people's actions and scenarios. And they pop into my head almost immediately because of pattern recognition and experience. And so somebody will say something, and a lot of people sometimes don't see the unintended consequence of their idea. And for some reason, God's given me the ability to jump to, these are 3 things that aren't going to be solved and actually would get worse. And so that makes me a little bit of a liability, but it makes me an asset too, because I'm able to help people problem solve in a way that a lot of people can't. But it does come across as arrogance sometimes because I have to slow myself down and take the time to explain to people my conclusions and my comments. So it's a curse and a blessing.
Like meeting people where they're at.
Yeah. But I used to be so impatient with people. And as I get more patient with people due to Carnivore Calm, I take more time to explain things.
I love it. I love it.
So, but it is my curse in life.
That's your cross to bear.
It is my cross to bear.
At least you don't have to bear it alone.
That's right. That's right.
Phil, as we're drawing to a close on our time together today, I just want to share that I've really enjoyed this, and I would love if you would be willing to share why do you suggest people consider a carnivore lifestyle or a carnivore way of eating, and do you have any tips for anyone that you would like to share?
Yeah, well, I think the very first thing is you got to have a reason to do something different than you're doing. It's not for the faint of heart, but if if you have a health issue, and that health issue could be obesity, it could be metabolic syndrome, diabetes, high blood pressure, heart disease, depression, anxiety, um, multiple sclerosis, Parkinsonism. I mean, you name it. Um, Consider that there's a lot of anecdotal evidence out there of people just like you who have gotten benefits from ketogenic diets and specifically the carnivore diet. And if you don't know the difference between the two, the carnivore diet is a ketogenic diet. It's just at the strict end of it based on the amount of carbohydrate you consume a day. So ketogenic diets tend to be 100 grams of carbohydrate or less. Um, some people need 50 grams or less. Some people need 20 grams of carbohydrate a day or less. I eat 0 to 2 grams of carbohydrate a day. So, um, and it's just because carbohydrates are not a mainstay. There are no essential carbohydrates. Your body can manufacture the carbohydrates you need, but they can't manufacture all the essential amino acids, i.e., the protein and the fats that you need for proper health. So, um, the carnivore way of eating fulfills the nutritional requirements without necessity for lots of supplementation, if any, in most people, unless you have a deficiency that you have to make up. And I would say that's probably knowing why you would do it is the thing that I will argue forever that is the most important reason that people start doing it and go through any adaptation or pain that they have in adapting the way they eat. Because it's not easy to make that conversion. You have psychological barriers, you have physical barriers, and those are too numerous to say in 5 minutes. But um, many people give up before they see the benefit because they don't want to go through that valley of feeling a little worse before they get better. And that's a shame. But if you have a big reason, like you had a reason you wanted to have a child and you saw no way to be able to pull that off, me, I felt like my life depended on it, my health depended on it. So that's a pretty big why for me. And I overcame a big why 20 years earlier. So I didn't mind making some sacrifice to get there. But the tips are you've got to internalize that why and be committed to it. And I could spend hours talking on how to do that successfully. But it starts by having some kind of a plan, being curious of I wonder if this would work for me, and wonder is also if I'm having issues, I wonder if I can get over those issues and get over the hump and make it successful. And it's often a matter of can I be patient with myself long enough to specifically walk through my plan and to arrive at the other end. And I think of the movie Planes, Trains, and Automobiles, where the two guys who were unintended partners in trying to get home for the holidays, they had to go through so many challenges, kept being thrown up. But ultimately, it was about getting home for the holiday. And are you willing to come home for your health and do the work no matter what it takes? And the other thing I see diverts people is I call it the airline safety rule that you always put your oxygen mask on first. So many people are always putting off getting themselves healthy because they feel like they've got to commit to a family member or a loved one and do what they want them to do or do what their doctor wants them to do. And they're always putting themselves second. There's a lot of codependency in our um, society where we put other people's first, and you have to really consider if you don't put your oxygen mask on first, you may pass out and be of no good to those people you love. And so don't try to change other people until you're willing to change yourself. Ask lots of questions and finally get in a community where you can learn from others and get through all the challenges we have to go through. And I did not think I needed community, but now after a year in community with a group of like-minded people, I find it very healthy and I love the support. And that's why I contribute. I was taught by one of my mentors in life that never go into an organization expecting to get more out of that organization than you're willing to give yourself. And if you always are willing to give more than you take, then that organization is always going to be getting stronger and be able to scale and help more people. So that's kind of the heart of how I approach things. And that's why I think community is so important. You got to do it with the right heart. So I hope that's helpful to someone out there.
I think it's super helpful, and I know where to find you, but if someone wants to find you and connect with you, where can they do that?
Well, I'm not on social media. When I retired in 19, I got off of social media and I was kind of forced to join the private network that Bella, the steak and butter gal, set up, which is really nice for me because I can interact with people. But my only interaction is really when I do live streams with YouTubers like yourself and with Bella. So I meet people in community every week, and some of them will hear this and recognize me. And I know Miss Alyssa came on when we went live, and it's always a pleasure to get to know her as a colleague of a fellow warrior and that journey to get optimal health. And I hope to meet you in the steak and butter gang.
Awesome. You guys, I will drop a link for the Steak and Butter Gang below where you can go ahead and join. There is a free community, or you can join our monthly challenge. It is $30 per month. It's well worth the investment, even if you come for 30 days and just check things out. That was my initial goal. I was like, oh, I'm just going to join this community for 30 days and see what I can learn. And then 30 days turned into 60, turned into 90. And then I was asking Bella if I could be a part of her team because I just loved what she was doing and I wanted to be a part of it. And
Yeah, I went in committing to 4 months up front.
okay.
So I pretty much said, I'm not going to do this for a month. I'm going to do it for 4 months.
Mm-hmm.
And
Mm-hmm.
if it doesn't create value, I'm out of here.
Yeah.
But
And
that was 8 months ago or
yes.
12 months ago. I mean, I finished the 4 months 8 months ago. So I've never left
Yeah,
because
I'm with you.
I
I'm
see the
with
value of being there. And I'm honored now that I do get to participate on some of the live calls and be someone there to help people. And are you going to Hack Your Health next November?
I am planning to. I am on the one of the panels with
You're
Bella
on the
next
panel
year.
with me.
Mm-hmm.
Okay. So we're going to be doing a panel called How to Survive as a Carnivore in a Non-Carnivore World. And
Mm-hmm.
my focus is how to turn your doctor from being a parent to being your partner in health. Because I think that's what I had to do. And there are skills you can learn on how to navigate the health system. And I'm really against people that think they don't need a doctor, that they just eat carnivore and nothing ever will go wrong. And personal evidence that sometimes you need a doctor to do something, and sometimes things do go wrong, and you need someone that you can look at risk benefits and talk through that. And I'm going to be doing an interview with Bella and Coach Raymond later this week, which will probably be posted sometime in the next month on YouTube, where I'm going to discuss my latest journey with some complications and how I have gone through the risk benefit ratio of informed consent with my own doctors. And I hope to help other people think through what's the framework of how you take a health issue and give it not only emotional, but logical evaluation of what to do going forward. I hope it's helpful for people.
I
Okay.
think it'll be helpful. And I think it's a very interesting topic because a lot of people are hesitant to try or even consider carnivore because they don't understand how they can do it in a world that is so against it. So I think it's going to be a great topic, and I'm looking forward to kind of brainstorming and seeing how we're going to do this talk. And I will also drop a link for Hack Your Health below, you guys, if you want to get save money on your tickets. You can do that. Bella has a code, and I will drop it all below for you guys if you want to get your tickets early. It will be in Tampa, Florida next year.
Yeah, pretty much this week, a year from now, at the
Yep.
Tampa Convention Center. And this is the cheapest you'll ever be able to register for it. So use the code Carnivore and go to it, hackyourhealth.com,
Yep.
and use the code Carnivore, and it'll get you a whopping $100 discount, which is amazing.
Yeah. Pretty significant savings on those tickets right now.
So
Awesome.
look forward to it. And I hope we have another conversation soon.
Oh, I'm sure we will. I'll be heckling you behind the scenes to ask when we can do another one.
Okay. Take care,
Wonderful.
everyone, and eat your meat.
Yes. And thank you all so much for coming. Don't forget to drop a comment. Let us know where you're tuning in from. Go ahead and like and subscribe. You can click the little notification bell to be notified each time I update new content. And this is Richelle, the Real Life Carnivore, signing out. Bye for now.